It's a good question. I tried about at least 4 times without any help of uh, patches or any smoking cessation. I tried it myself. At that times, I wasn't aware of this smoking cessation services and things like that.
Yeah.
But all those 4 times, it was absolute failure.
Okay.
Initially, for a few months, I managed, but then get into some drinks parties or birthday parties or something like that, and then after a few drinks, some friends might offer you one, and then you take that, and next day you go to the shop to buy more cigarettes, and that's always a failure.
Okay.
Smoking cessation service staff used to come to the ward to see patients. Then I was getting interested in it too, the way the patients were getting help. So one day I did speak to Polo Kane, and he was happy enough to give me an appointment, and that's how we went on with it. And with the help of patches, I was able to stop smoking, and it was good. I'll say it is definitely good because I myself tried over 4 times and failed. So with the help of smoking cessation, I was able to give up. Now it is over a year, nearly 1.5 years since I gave up smoking. So it is very good service. If you're talking about benefits, yes, finance, one thing, health, and then especially with the kids at home, you're not smoking in front of the kids, so they're not watching you smoking. And even when I smoked, I never smoked in the house, I always went out. So that meant kids always watching you through the window or through the patio door, as if watching something, and as if they're watching something in the zoo or something. It wasn't a nice feeling, but when I'm looking back on it now, I think it was bad, but now I'm glad that I did stop. I think it is a good thing to do for everyone, and yes, of course, there is going to be problems. Those who smoke may be against it, but from my experience, who was a smoker and now gave up smoking, and I think it is very good idea to go smoke free. And initially there is always going to be that bother, but with the help of smoking cessation or with the help of this through the GP or different services, if we can get rid of smoking, that's the best someone can do for themselves and the family.